Did you know that?
Asian Americans, Native Hawaiians, and other Pacific Islanders, or AA&NHOPIs for short, represent over 49 ethnic groups and 100 different languages. America's AA&NHOPI community is diverse and includes people who have origins in East Asia, South and Southeast Asia, Hawaii, and other Pacific Islands.
Did you also know that?
AA&NHOPIs are the fastest growing racial and ethnic minority group in the United States. In 2011, there were 18 million AA&NHOPIs living in the US. That number is expected to grow to 43 million by 2050. Despite the common belief that AA&NHOPIs are an educated, healthy, and high-achieving group, statistics show that this population experiences many forms of hardship. From 2007 to 2011, the number of AA&NHOPIs living in poverty increased by 38%, a rate higher than most other racial ethnic groups. Poverty can mean a daily struggle for adults looking for stable jobs and housing, or families with limited access to healthy food options. In addition to poverty, many AA&NHOPIs face difficulties as a result of being new immigrants or being limited English proficient. One difficulty is receiving healthcare that feels respectful of differences in culture and language.
We just need a doctor who understands us. I am a single, uninsured mother of 3 working 4 jobs.
This Filipino mother and her family living in rural Hawaii is one example of the many AA&NHOPI families who have difficulty accessing healthcare.
I didn't know where to go until my neighbor told me about our local community health center.
Through community health centers, over 760,000 medically underserved AA&NHOPIs are able to receive primary, preventative, specialty, and behavioral health care that is culturally and linguistically responsive.
What does that mean?
It means that anyone can see a doctor or nurse who will respond to the needs of their culture, language, or background.
Thankfully, my community health center provided me with a mammogram, a surgical consultation, and an interpreter.
The Association of Asian Pacific Community Health Organizations, also known as AAPCHO, works with community health centers that prioritize culturally and linguistically appropriate services for AA&NHOPIs. In 2011, AAPCHO's 33 members served nearly 400,000 patients, 51% of whom were best served in a language other than English. AAPCHO advocates for national policies and programs that are community-driven, financially affordable, culturally appropriate, and linguistically accessible. We believe access to care must be guaranteed for all, and we work with our community health centers to ensure that everyone is happier, healthier, and stronger.